Hi everyone. So welcome back to another video on cancer. This month, October, is Breast Cancer Awareness Month. So you're going to hear a lot of breast cancer from everywhere and from me. I'm even wearing pink today. Why? Because, well, pink is the breast cancer color, sort of. So, in the last videos, we've talked about breast cancer screening, and I also explained in some other videos on how cancer comes about and some of the risk factors of cancer in general. Today, I'll tell you about the symptoms of breast cancer, meaning if, God forbid, you have breast cancer, what would it feel like? What would you see or feel to suspect that you might have it and go straight to the doctor to get tested? So in some patients, they actually don't have any symptoms. These ones, we call them asymptomatic, meaning they don't feel anything. They examine their own breasts and there's nothing that they feel, there's nothing abnormal. It looks perfectly fine and it feels perfectly fine, but they have the cancer. So how do we detect it? I spoke about this in the previous video, that is through screening. If you have symptoms, what will they be? So the most common symptom, more than 93 to 96% of patients who have cancer present with a breast mass, meaning it's a swelling, it's something that it's a tumor that is abnormal, that is felt within the breast. More than 90% of cancers present themselves like this, meaning they show like that, by having a breast mass. Now this breast mass, it can be of any size. It doesn't have to be painful. In fact, most of the time, it's not painful at all. And that's what makes patients delay seeking treatment, because they're like, yes, I feel something, but it's not painful, so I will not go to the doctor. So most of them are actually painless. And they may not have any other symptoms other than the mass. Now, other symptoms that patients may have, that they may not be a mass, so they could have an abnormality with the nipple. It may be retracted inwards, meaning it's sort of been pulled inwards instead of being projected. Or they may have a nipple discharge, meaning some watery stuff is coming out from the nipple, which is not breast milk. And it may be of any color, but the most suspicious one that makes us doctors worry is if it has blood in it. That's when we start getting worried and we have to test you. Now, other patients may have some pain, although it's very, very rare. And usually, if they do have pain, it is associated with some skin changes. So another symptom is if the skin of the breast changes in any way. For some patients, it may become like an orange peel appearance. So you see how the orange peel looks like? It sort of like has dots. So that's how the breast skin changes into. And usually that's one is in the later stages. So with such patients, if we ask them, we may find that they've had a mass for like a year, they ignored it, and then it reached the stage where the skin has also changed. Or it's even broken down and given an ulcer. So if you have any of these symptoms or any other symptoms within the breast of any kind, whether I've mentioned it or not, please visit the doctor as soon as possible. But also don't become so paranoid. I mean, not every symptom means cancer, but cancer is usually the first thing that we as doctors need to rule out. So do not be afraid, go to the doctor so that you can get tested. Thank you for watching. On the next video, we are going to talk about risk factors specific to breast cancer. Stay safe and stay healthy.